Pollution consulting firm, and I'm probably the only meteorologist here. My expertise is not health. It's really trying to work on how to curate data, how to build data systems and bring data to the public so that they can make a health-based decision. So I'm working on that side of the equation here, and very excited to be here to talk with all of you about how we can take information and we can create action. And what I want to do in the next couple of minutes is tell you about two systems that we've built. One is for the Environmental Protection Agency, and it's kind of the current state of air quality monitoring as it exists. But I think there's really an exciting and emerging trend coming where I want to talk about low-cost sensors, personal sensing. And I think that has huge applications for what we're talking about today. So the first project here, this is AirNow. And you can go to airnow.gov, and you can find the current air quality across the entire nation. Data are collected from 2,000 monitoring sites that are operated by 140 different air quality agencies. This data is aggregated at our office in the north side of town, and we push that information to the public so they can make a health-based decision. One of the key things here is we take concentration of pollutants and we convert that to this nice thing called the Air Quality Index, a color-coded scale that has health effects information with it and has actions that people can take. And this program's been around for about 15 years. It's been very successful. The data are reliable. They're high quality. There's one problem, though. The data are regional. They're not in my backyard or your backyard, so they don't pick up everything. And the interesting thing is there's now an exciting trend that's happening, and that's this whole trend of personal air samplers. These are devices, and I brought a couple of them with me. This is one right here that measures particulate matter, so particles in the air. It's about $100, $150. This one's made in China, works quite well in China, where the pollution's rather high. So these devices are emerging right now. There are literally over 100 companies that are developing these types of low-cost air quality sensors and pushing these to market. Some of these work well. Some of these actually work really bad and can be misleading. Some of them actually work surprisingly well, and it's very encouraging. And I think, in a couple of years from now, we're going to have devices that are extremely small that people can wear, people can put in their homes, etc. There are, and we heard about this earlier, a number of issues with privacy. How will this information be protected? How will it be shared? Who will own it? How will the information be used? There are issues with what does this represent? What does it mean if I walk around down the street with this and I see a spike of particulate matter? What action do I take? And so there's a lot of work that needs to be done on actions that I can take with this type of very high time resolution, very localized and personal information. The next thing I want to do is show you just a couple of examples of work that we've done. But when I envision the future, I think about individuals using these devices to protect their health. There's also movements to curate and share this data and crowdsource the data. There's not enough devices out there yet to really crowdsource it. And ultimately, I think it's going to be built into our infrastructure. And there's an interesting project going on in Chicago right now where the city is deploying 500 monitors that are monitoring weather conditions and air quality conditions around Chicago. And this is a pilot to see how can they use this information to better depict what's happening within the city and to try and figure out, can we crowdsource and use that information to make health-based decisions? One of the exciting areas is really how can we use this to reduce exposure? Monitoring pollution along a busy road. Do I run along the busy road, or do I run maybe 100 yards inland where the air pollution is likely a little bit less? One of the areas that I've really enjoyed working on is identifying and solving problems. And this map right here, this is Northern California, okay? And this is a city, Santa Rosa. It's about 160,000 people. And this is about a 3 by 3 mile area. And what we did was we took one of these pollution sensors, we put it in a car, and we drove around and measured particles in the air, so PM 2.5. And what we found was, repeatedly, is the people that lived up here, about 100 feet up on the hill, breathed better air than the people right down here. Okay, and the difference here, this is about a mile. Okay, so huge differences. And the issue is this is in the valley, and there's also smoke that's being generated because people are burning wood in their fireplaces. So individuals here, mothers, families, kids, are breathing unhealthy air all night. If you live up here, you're breathing healthier air. The reference station for this particular site was located about 8 miles to the west. Okay, and it picked up code yellow. So it doesn't pick up all these granularities. And that's one of the problems with this, and also one of the potentials. The last thing I want to talk about is I think this has a huge capability to create new awareness. Wearing these devices, looking at the data, we begin to get a new understanding. And I know that really through just personal experience. We created this program called Kids Making Sense. And I didn't know anything about education. I just knew that I really liked working with these devices. And we created this program called Kids Making Sense, where we go in and we work with students and we work with teachers. We talk to them about pollution, the sources, the health effects, how to go out and make measurements. And then they go out and they make measurements in their community using a device like this. And just it reports real-time data on the phone. And I've been monitoring us as we've been talking here. They make the measurements, they walk around their neighborhood or their city, they come back and they discover things en route, they come back and they crowdsource the information and talk about what they learned. And you know, the interesting thing is, they come back with stories like, gosh, you know, it was really high where people were smoking. And I think some of us would be like, well, duh, that's obvious, but it's not. They're able to connect measurements. We can measure it, we can manage it. They're able to connect the numbers. And for some reason, when they see the numbers there, it resonates more than just kind of talking about it. So that's been one of the fascinating things. And I'll leave you just with a story about this program. We did a training over in Sacramento, and this was with Magnet High School in kind of a disadvantaged community on the south side of Sacramento. We brought these devices in, we worked with the teacher, and the students came up with a hypothesis. And they said, look, we think the pollution is higher out on this busy road in front here than it is in the back parking lot. So the teacher said, fine, let's design a measurement program for that. So they designed a measurement program, collected data at different times of day throughout the 3-week period, wrote up the report, and found pollution was higher in the back parking lot where all the buses were idling. And so it leads to new understanding. And I think having these measurements is one of the keys to really kind of driving behavior change. Be it kids, you know, we were talking before about kids asking questions and asking better questions. This is one of the ways to do it, is to give them technology that they're expecting and are going to be familiar with. So I think this really has huge potentials for what you all are talking about today, and excited to be participating in this and looking forward to the discussion and interactions. Thank you.